Hi, good afternoon. My name is Tarani. Today I am going to talk about urinary incontinence. Nowadays, more people are suffering from urinary incontinence. Let's see what is urinary incontinence. Yeah, urinary incontinence is the loss of bladder control. It mostly occurs as the people who are getting older, especially women. It is a most embarrassing problem nowadays. Let's see what is the signs and symptoms occurring in urinary incontinence. First one is leaking of urine while we are coughing, sneezing and doing some exercises, also laughing also. Okay, frequent urination, waking up at night to urinate. These are the signs and symptoms. Let's see what is the causes of urinary incontinence. Okay, during pregnancy time, the uterus presses down to the urethra, so it causes incontinence. During menopause, the estrogen level becomes decreased, so the vaginal tissue also becomes thinner, so it causes urinary incontinence. When we are taking more medications also, it causes incontinence. Like during constipation, it leads to impacted stool, so it causes urinary incontinence. Okay, when we are taking more consumption of diuretics like coffee, tea, energy drinks, these are all causing urinary incontinence. Okay, those days, before 10 years ago, 15 years ago, in our medical field, in our physiotherapy field, we are using some techniques, only some techniques we are to prevent the urinary incontinence. Let's see what are the techniques. Only few techniques. Kegels exercises, pelvic floor muscle strengthening exercises, bladder training, behavioral therapy. This all the techniques those days we are using to prevent the urinary incontinence. But nowadays, in this modern world, we are using so many modern technologies to prevent this kind of problems. Like, okay, let's see. Today we know more about the human body, its symptoms, causes, diseases and all. Okay, in this, due to advancements in modern technology, we have newer, modern and also many advancements in this century. Okay, today we are going to talk about, just now we are talking about urinary incontinence, right? Okay, let's see the modern technology. Nowadays the modern technology, how it works to cure this kind of problems. Okay, now we are going to see Emsella. It solved the urinary incontinence. We all heard about Emsella, but so many people don't know about Emsella. Okay, today we are going to invite a special guest whose name is Venishri. She is a BTL product specialist. Today we are going to take some interview about, she is going to explain about Emsella. Yeah, let's invite Venishri.
Hi everyone.
Hi Venishri.
Hello. Nice meeting you.
Okay.
Okay. Thank you.
How are you?
I am very good. I'm very good. How about you?
Yeah, I am fine, Venishri.
Okay.
Okay.
So thanks for inviting me. So thank you so much for joining our live today. So I am Veni from BTL. So we are going to talk about Emsella today basically. So I believe you have like few questions about Emsella, right?
Yes.
Yes. So and also like I think like you have already explained on what is urinary incontinence and how people suffering with urinary incontinence and all, right? So maybe like from my side, I can touch more on how does this work on urinary incontinence, okay?
Yeah, okay.
All right. So can we start?
This is Emsella. This is the modern technology which is cured in urinary incontinence. Okay, let's start our questions. Okay, can you explain me what is Emsella?
Okay, so basically Emsella, as all of us know, urinary incontinence, we have so many like treatment for urinary incontinence basically, but most of the treatment it becomes like invasive. Okay, and not every woman like come out and tell that they have urinary incontinence basically. So what we have come out with is a easy handling machine, okay, and a very fast recovery rate, Okay, and also we are trying to do something with non-invasive management. So when we have our own R&D team, okay, so research and development team. So after so many researchers and all, we have come out with Emsella. So Emsella, basically you just need to sit on Emsella, okay, to get a pelvic floor muscle contraction. Okay, so basically when it comes to pelvic floor muscle contraction and Kegel exercises and all, right, usually we really need to take a long period of time to do a continuous management, correct or not? So, and it is not easy for everyone to do those exercises, okay, especially when it comes to pelvic floor contraction. Okay, so what we have come out with is, we have come out with a very unique and also very new technology, very higher end technology, whereby Emsella uses a high intensity electromagnetic field. Okay, it uses a high intensity electromagnetic field, and the field, I mean that waveform is actually formed from the coil which is located below the seat here. Okay, so there will be a coil underneath the chair, so that coil is actually forming the electromagnetic field. So basically it will be a focused type of waveform. Okay, so when a person sits on the chair, right, so we will ask them to tilt their pelvic and also open up their leg, so it can actually target the vaginal opening area. Yeah, so the first treatment is actually to actually stimulate the vaginal opening area, and slowly it will actually target the pelvic floor muscle. So a direct stimulation to the pelvic floor muscle, it creates actually very fast contraction. We can say it as a supramaximal contraction. All right, so usually our if in a medical term, right, so we need an action potential to have a muscle contraction, right? So here we have a supramaximal contraction, so that the stimulation of the muscle is actually higher. All right, and that is the reason why people can get faster recovery out of this treatment, basically. Okay, so one treatment will take about 28 minutes. Okay, patients just need to sit on it without exposing their treatment area. So that is the best part of the machine, basically. Usually when it comes to urinary incontinence, they need to expose the treatment area, and that there will be a invasive type of treatment going on. But here uh, totally different. Okay, they just need to sit on it. It's operator free management, meaning patient just need to sit. Okay, we will actually set the parameters and all, and the therapist can actually leave the room. Yeah, so for that 28 minutes they can read some book, or they can be relaxed in the room. Okay, so that 28 minutes of treatment is equivalent to 11,000 of Kegel exercise, which is impossible to do by a person on their own. Yeah, so that is where we actually achieve a very fast recovery in urinary incontinence. Yep.
Yeah, okay. I hope you all guys understand what is Emsella, right? Okay, next question is, does Emsella really work, and how long do Emsella results last?
Okay, so if you ask me, does Emsella works or not? Definitely yes. We have a proven studies. Okay, we have a clinical studies. All of you can actually visit our website also, www.btl.com.my. So you all can get a clinical studies also. Like usually when you search for clinical studies, of course we have a proven clinical study saying that it really works on people. And also we have stages in urinary incontinence, right? So any physiotherapist, before we do any treatment, we will do an assessment for the patient. So during the assessment, you will know how bad is your urinary incontinence and what type of urinary incontinence do you have. So basically here, usually we will tell them to get a 4 treatment as a beginner. Okay, so 4 treatments, from first to second treatment itself, they can see the changes in their urinary incontinence problem. Yeah, so that 4 treatments, I would say it's a complete treatment. And the duration, like how long they have to do in a day, 28 minutes only, and then they have to do it once a week, because it's giving you a supramaximal contraction, right? So if you're doing it again and again in a week like that, it might actually contract the muscle, which we don't want. Okay, so we advise them to get this treatment once a week basically. Yes. Okay, and that for treatment, I would say it's good enough for a patient. Of course, totally depend on the therapist also. If they find it's a very chronic level of urinary incontinence, they can extend up to 6 sessions also. Yeah. Okay, and also if just now you have asked how long does it gonna last. Okay, you must understand pelvic floor muscle is a muscle just like our deltoid or any other muscle in our body. If you stop working the muscle will go for wasting. Am I right?
Yes.
Yes. So pelvic floor muscle is a muscle. You need a maintenance for the muscle. Okay. So if patient comes to you with a urinary incontinence problem, you already completed 4 sessions with them and they are okay now. They are recovered from that. You have to advise them as a maintenance. Once a month they can come and do. Yes. Yes. So you can advise them in that way. Okay. Did I answer your question?
Yeah, thank you.
Okay.
Next question. Is Emsella is FDA approved?
Definitely. Yeah. Yeah. Even okay, in Malaysia we have MDA, right?
Yes.
So MDA, like FDA is in America. Okay, it's FDA approved, and here in Malaysia is MDA approved. So any hospitals or physio centers or private government hospitals centers, they can actually like use it without any hesitation, because sometimes they might be thinking whether do they have any side effects, okay, out of this treatment. Basically, since we are MDA approved and we have proven clinical studies, it is safe to use on your patients.
Okay, thank you. Next question. How many Emsella sessions do your person need?
Yeah, I think I answered this previously. If you ask me, a person needs, okay, in our like protocol, like every machine has its own protocols, right? So we would say like 4 session is like a complete treatment for that one particular patient. But let's say, as I said, when you do an assessment, a physiotherapist do an assessment, and you find out it's a very chronic condition, right? You may actually like increase it to 4 to 6 sessions. Yeah, but again I'm telling you, you need a maintenance after completion of that that sessions, right? The one set of sessions, you need a maintenance once a month, so that is needed. Yes.
Yeah. Can I ask you next question?
Sure.
What does the Emsella treatment feels like?
Okay, usually since you are a physiotherapist,
Yes.
have you feel like any stimulation currents, right? Electrical stimulation, just like that. But this will be, I won't say it's a discomfort feel, it's something like when you sit on it, right, you will just feel some kind of ticklish. Yeah, so that is how usually patients will start to feel. And also when they sit in a comfortable position and a very accurate position, right, because we're going to target the pelvic floor muscle, so they need to feel the stimulation, because the wave going to be in a focused waveform. Okay, so they will start to feel the vibration or maybe the stimulation around the vaginal opening area first, then only it will actually gradually it will go to the pelvic floor muscle, and it targets directly on the pelvic floor muscle. Yep.
Yeah, thank you so much. Can you do Emsella while on periods?
Okay, if you ask me, Emsella, okay, it is actually stimulating and also it strengthen up your pelvic floor muscle. That is the whole idea about the machine, right? But it has also a tendency to increase the blood circulation on that area. Okay, so if you're having periods, right, menses, so your blood flow will be there, so we don't want to over like stimulate that. So I would say you can use it maybe on the 4th or 5th day of your menses, not on the 1st to 3rd days, like that. Yeah, so just to avoid the overflow problem, that's it.
Yeah. Is there any side effects in Emsella?
Okay, as any machines, any modalities, electro modalities, right, it has its own contraindication. Rather than saying side effects, I would say contraindication. When and to whom you shouldn't use the machine. Okay, for Emsella, cancerous patients are not advised to use the machine. Okay, and also pregnancy women. So post labor is different. Okay, during labor, during pregnancy, we say no. Yeah, so because it's a electromagnetic field, okay, and it's a high intensity electromagnetic field. So pregnancy is contraindication for any electromodalities. Yes, so we don't advise them to use. Okay, and then if the patients, because you know about IUD and all, right? So if they have any metal implants on the pelvic area, we not advise them to use, because as I mentioned, it's a high intensity electromagnetic field. So if there's a metal implant, the chances of connecting is high, so which is not advised. So that is contraindicated. Side effect, usually I will tell them use once a week is better, or twice a week if let's say the condition is very chronic. Apart from that, so far we have never get any side effect complaints from our patient or from our customers actually.
Is there the renal failure patients also can do Emsella?
Yes,
Can,
they can actually. And also, like sometimes you have patients like diabetic patients, their sensation is very low, right? The sensory deficits will be there, right? So for those kind of patients, you need to actually ask the feedback from them when they sit on it. And also, of course, you need to do a first level of assessment before you give this kind of treatment for them. And also every time, like you can actually ask the questions to them, whether do they feel it on the correct spot, are they feeling the proper level of stimulation. So this kind of questions you can ask them basically.
Yeah, okay, thank you. Okay, next question. How do you sit on the Emsella chair? What is the position?
Okay, so I think I may need you to actually sit on it, then I can advise you how to actually position yourself. Then I will start the treatment maybe, so you can actually sit correctly and you can feel the contraction basically.
Yeah,
okay,
can.
is it?
Yeah.
All right, come. Okay, so usually when it comes to sitting position, right? Okay, is there any metal implants?
No.
No. So menses?
No.
No. Okay, so you are good to use Emsella now.
Yes.
So usually when we sit on the Emsella, right, you need to actually sit with you have to go a bit inside. Okay, so you are not supposed to lean too backward like that, and then in this position you need to wide apart your legs. Okay, and then your pelvic, right, you have to tilt it a little bit. Yes. Okay, do you feel?
Yes.
Okay, so this is how usually you need to sit on the Emsella. So for patients like you're not very big size, okay, you are just nice, okay, so that's why we given you a pillow just to fit you. Okay, if let's say the patient, because some old patients, right, they will have back pain, they will have like knee pain, something like that. So if you are healthy enough and you are very young also, that's why you don't have any pain. But for you to make them sit on this chair, you need to adjust their placement. So this is how the position should be. And also another thing, we will get shorter patients, we will get a taller patients like that. So we have actually so we have a remote control here that you can actually adjust it. So you can actually adjust it high and low. Yes. So usually when they sit, right, the position of their leg has to be very comfort, okay, and their heel has to be placed fully on the floor. All right. So, and this is attachable, so you can attach it after that. So like now I'm going to start the treatment. So usually when it comes, so once you position the patient, any metal implants or any gadgets like phone, watch has to be removed.
Yeah.
Okay, is there any phone in your pocket?
No.
No. Okay, maybe just that. All right. Okay, so
Ring scan.
ring scan. So you can rest your hand over here, or if you're okay to put it on your laps also fine. Okay, the first thing, okay, when I start, right, we call it as a therapy targeting point, meaning that do I really target on the correct spot or not? Like, do you start to feel it?
Yes.
You
Okay.
okay?
Percussion.
Yes. So do you start to feel on the vaginal opening area? That is where you supposed to feel it. Okay. Is that correct?
Yeah. Correct.
Okay, so if it's correct, if no means you can adjust it. Okay, you can adjust yourself. And if it's okay, then I will enter. Then I will increase the intensity. Do you start to feel now?
Yeah.
Ticklish?
Yes. Very.
Okay, can I go more?
No, enough.
Enough. Okay, this is about 23% out of 100%. Okay, so you can hear some kind of sounds, right?
Yes.
Okay, this is actually the frequency of it, the frequency of the waveform basically. So Emsella has various type of frequency, and why we have different type of frequency is actually to avoid the muscle adaptation. Okay, so because when you give something like TENS, okay, if you are using TENS, right, if you are using TENS for a patient, maybe after 1 to 2 minutes like that, you need to increase the intensity of the TENS. Am I right?
Yes.
Why? Because that current adopted by the muscle, right? So that won't happen here, all right, because we have a different level of frequency. So that different level of frequency usually will avoid the muscle adaptation. And another thing is, it will give you a very good recovery like process. That is what recovers you faster from here. Okay, all right. And then this whole process will take about 28 minutes only. Okay, so during this time, if let's say the patient feels a bit discomfort and all, you can actually advise them to lean on the like pillow. You can actually put a pillow on the at the back actually. And also if let's say they feel boring or anything, you can give them a book, or if you have a TV, you know, in a room, so you can actually like make them entertain in any way. So their work is just to come and sit on this chair comfortably and have the treatment for about 28 minutes.
Yeah,
okay,
it's vibrating. And
yes, so you can feel a different level of stimulation.
Yes.
That is what actually giving you a proper recovery process. Okay, all right.
Yeah.
Okay, would you like to continue?
Yeah.
Okay, all right. Okay, so even during the treatment, if let's say patient said I feel a bit more ticklish or anything, you can actually pause it. So when you pause, it will, the time will remain same. Okay, so you don't really need to set everything from the whole. Okay, all right. And then when you end the treatment, this is how the sound will be. So this says that the treatment is end, and you can see also the light blinking.
Yes.
This shows the treatment is end. Okay, during the treatment, the light will be stagnant over there. Okay?
Okay.
All right.
Yeah,
There you go.
Yeah, thank you. Last question.
Mm-hmm.
Can you describe me the uses of Emsella besides urinary incontinence?
Okay. Okay. In medical, we are using it for urinary incontinence. Okay, and there are some doctors also been asking, can we use it for uterus prolapse? Okay, so there are stages for uterus prolapse basically. Okay, it can actually support you. It can actually support you in uterus prolapse, but it is not going to 100% cure the prolapse, because it's a prolapse, you see, and this is actually work on the pelvic floor stimulation and strengthening of the pelvic floor muscle, right? So people who have like the first stage of uterus prolapse, they are advised to actually use this. Okay, and apart from women's health, apart from women's, ladies, men's also can actually have it. They can have this treatment for ED problem, erectile dysfunction. It can actually also support them. It can also help them to actually, you know, regain back the problem. Yeah. So this I would say it is not only for women, and it is not only for urinary incontinence. It helps people in many ways actually. Yeah. And also this I would say it's very friendly first, because you tried it. Okay,
Yes.
there's no any like, you know, hidden buttons that you need to play around with the machine. It's very direct. Okay,
Yeah.
it has one controller like this machine, and it has like one applicator chair. All right, you just need to play around with this. And the protocol, we already set a protocol, like an urinary incontinence protocol. Even for the users, it will be very user friendly. So they just need to click on the protocol, they can just start. So in every treatment, the first session when you start, right, the therapy targeting point, whether you're targeting the correct spot or not to stimulate, okay, that is important. During that time, you can actually adjust the patient. After that, you can start the treatment. Once you start the treatment, for about 28 minutes, you can actually leave the patient and you can actually go out from the room. So that easy is the treatment, and very fast you can get the efficiency of the treatment.
Yeah, thank you so much, Ms. Vinishri.
Yes, thanks a lot.
I'm greatly honored to meet you today
Thank
on this
you, thank
useful
you.
occasion. Yeah, okay guys, I hope you all understand about Emsella and understand about the urinary incontinence. Yeah, just now she said pelvic floor muscle strengthening for also sexual health also can use this Emsella. Okay, thank you. Okay.
Thank you so much for inviting me also. Please come to Fisioasia. I think in Klang Valley, Fisioasia is one of the physio center, one and only physio center having Emsella chair. And also here we have another machine of BTL, which is super inductive system. And I hope in future we will do another live with super inductive system also. Okay. Thank you so much for inviting me.
Thank
Okay.
you,
Yeah.
Yeah. If you need any treatment in Emsella, then call to this number or WhatsApp this number. Okay, I kindly request you all guys to come to Physiotherapy Asia to take this kind of modern technology treatment and stay happy and live healthy. Thank you so much. Bye bye.